misunderstanding number 3. Strengthening core muscles or making your spine flexible will fix your low back pain. That's one of the most common and dangerous misunderstandings. Hi, this is Dr. Chung, the Physiatrist in Seoul, Korea. If YouTube has recommended this video to you, you might have low back pain, neck pain, or joint pain. Or maybe someone in your family does. Because I have been writing and talking about spine and joint pain for almost a decade. Yet, in Korean language. And I guess I've helped more than 1 million Korean people by providing them information about it. Recently, I was wondering if the information could also be helpful to other people in other countries as well. So I began learning how to speak English for a while, and it took some time, of course. And now, this is my first English video to talk about degenerative spine and joint pain. Yes, I said degenerative spine and joint pain. The word degenerative may sound a bit strange. It's even hard to pronounce for me. Degenerative, degenerative, degenerative. But what it really means is simple. It refers to common everyday neck pain, back pain, and joint pain that come from wear and tear of our muscles, bones, and joints. Especially joints are important. The joint is a collection of soft tissues, tendons, ligaments, and different types of cartilages. And they are the key structure of wear and tear. In another word, degeneration. Degeneration is just a posh word for wear and tear. When I was a younger doctor in training, my professors told us not to use the word degeneration or degenerative, especially when we talk to our patients, because the word can imply something is falling out, something is getting broken, something is worn or torn with prolonged usage, which can make the patients quite worried, concerned, anxious. But after 25 years of practice and seeing almost 50,000 new patients in my clinic, degenerative spine and joint pain is the best diagnosis that you can have when you have spine or joint pain. Why? If it is not degenerative, then what could it be? It could be cancer, infection, or rheumatologic disease, all of which are much worse than degenerative conditions. Let me give you 3 real cases from my clinic to elaborate this issue. The first case, a 33-year-old man had low back pain for about 4 months. It started just after lifting a bucket of water, quite a common story, right? Though the pain got worse over 4 months of period, sometimes it got better for a while, mimicking common, usual, degenerative low back pain. But after 4 months, the pain became unbearable. He could hardly get out of bed. An MRI revealed metastatic cancer in his lumbar spine at the L4 level. It was a completely different story from degenerative back pain, even if it looked like one. He went through radiation therapy and strong chemotherapy, but sadly, it didn't end well. If he had been told, it's just degenerative pain, he probably might have been much happier. The second case was a 40-year-old man, tall, strong, and very active. He often had mild back pain previously, comes and goes from time to time, but this time it was different. The pain was intense, even when lying down at night. Usually, degenerative back pain gets better when you lie down. So, this was a red flag. His MRI showed an infection around the L4-5 disc space. He needed surgery, actually 2 surgeries, and intravenous antibiotic treatment for more than 6 weeks. That's much more serious than a degenerative spine problem, right? The third example is a rheumatologic condition. Diseases like ankylosing spondylitis or things like that. They often mimic degenerative back pain, but the cause is totally different. Not by wear and tear, but by inflammation caused by our own immune system attacking our own soft tissues. Sometimes the diagnosis is delayed because early imaging can look similar to simple degeneration. But once diagnosed, they need proper medical care, sometimes advanced, sophisticated biologic treatments. A 35-year-old woman came to my clinic with back pain lasting more than a year. Her x-rays showed a slightly narrowed L4-5 disc space, which looked like an ordinary degenerative change, the kind that we often see at the L4-5 or L5S1 level. But when we did an MRI, things looked different. There were distinctive erosions along the entire range of end plates. The end plate is the area where the bone meets the cartilage disc, which is very important to the health and integrity of the disc. The extensive erosions of the L4-5 end plates were not the typical pattern of simple degeneration. After additional blood tests and imaging studies, she was finally diagnosed with ankylosing spondylitis, a form of inflammatory arthritis that can mimic common degenerative back pain. Having rheumatology conditions is not as bad as having cancer or infection, but depending on its spectrum, it can progress to serious disability, demanding lifelong medical care. So yes, I'd much rather have degenerative back pain rather than a rheumatologic disease. Here's the good news. Here's a more fundamental reason why you should be happy with the diagnosis of degenerative spine and joint pain. Most degenerative spine and joint problems are self-limiting. They get better on their own with time. It's because each pathology by degeneration has its own way, its own natural course to recover. Disc herniation behind sciatica, a bone marrow lesion for intense knee pain, or calcific tendinitis causing sleepless shoulder pain. You name it. They get better on their own with time. Most of them, but not all of them though. Sometimes degenerative spine conditions need urgent care. For example, we recently saw a 22-year-old man with sudden, severe back pain just after sneezing. Soon after, he felt weakness in his legs and couldn't urinate. He could not pee. His MRI showed a large L4-5 disc extrusion pressing on the spinal nerve roots. He had immediate surgery to remove the big extruded disc material from the spinal canal to relieve pressure on the nerve roots. Thankfully, his strength and bladder function recovered almost completely. So yes, degenerative spine problems are usually safe, benign, self-limiting, but when muscle weakness or bladder symptoms appear, they require urgent medical attention. Now, some people may be offended when I say degenerative pain usually improves on its own. They've been suffering for years, maybe 5 years of back pain or 2 years of neck pain, and feel hopeless. Indeed, most of the patients who are coming to my clinic are falling into that category. But in my experience, the real reason their pain lasts so long is misunderstanding. Misunderstanding the cause of pain, misunderstanding the mechanisms of injury and healing of our soft tissues, misunderstanding how to move our body to make our painful soft tissues heal better. When the patients got fully informed, they can correct their misunderstandings. With shrewd understandings and deep insights, they get better, but not immediately, because it takes time for painful soft tissues to recover, to get healed. It may take 3 months, 6 months, or sometimes a year or 2, but eventually they get better by just understanding their conditions clearly. How wonderful is that? Understanding is the best medicine. That's why I'm making these videos, to tell you the truth, to bust your myths, to clarify your misunderstandings about degenerative spine and joint pain. Before I end, let me briefly introduce the 3 biggest misunderstandings that make back pain so persistent. Misunderstanding number 1. Radicular pain or sciatica comes from compression of nerve root. That's not quite true. Compression is involved, but just partially. The main cause is inflammation especially around the dorsal root ganglion, so-called DRG, which is a lumpy, bulbous part of the nerve root. It is lumpy and bulbous because cell bodies of sensory nerves are held together. If you don't have inflammation in the DRG, you will not have radicular pain or sciatica, even if the nerve root is compressed or stretched. I will elaborate this in future videos. Misunderstanding number 2. Axial low back pain comes from muscles or ligaments in the spine. Again, not true. Axial back pain is the kind of back pain that stays in your low back or buttock, not going down to your legs. Most axial back pain comes from the intervertebral disc, the cartilage cushion in between the two vertebrae. When the disc is injured or torn, they send pain signals to the brain so we can feel axial back pain. And when they heal, the pain disappears. So the real goal is to help the disc heal naturally, the best mechanism to get out of low back pain. Actually, the second misunderstanding is related to the third one, which I think is the most important mechanism to make your low back pain last forever. Here comes misunderstanding number 3. Strengthening core muscles or making your spine flexible will fix your low back pain. That's one of the most common and dangerous misunderstandings. Strengthening your core and improving your flexibility is good, very good for performance in sports activities. With a stronger core and a more flexible spine, you can drive a golf ball further and even pull off a spectacular bicycle kick on the soccer field. But it doesn't necessarily relieve pain. In fact, doing those exercises with an injured disc can re-injure it and prolong your pain indefinitely. It is something like doing dumbbell biceps curl exercise with your upper arm broken. If you are suffering from chronic low back pain, you better check out your exercise or stretching routine to see if there's any disc ruining activities. That's why I plan to make 20 or 30 videos to explain all these mechanisms step by step. The real causes, the myths, and the ways to help you spine recover naturally. This is the first video introducing what I would talk about in the future. You don't have to memorize everything. Remember just 3 things for today. Number 1, having a degenerative spine or joint problem is not something to fear. Number 2, there are certain symptoms requiring urgent, special medical attention, muscle weakness, bladder symptoms, or too strong pain, so-called red flag signs that you should go to your doctor as soon as possible. We may talk about it in the future. Number 3, if it is just degenerative spine and joint pain, then understanding your condition is the best medicine that you can have. That's it for today. See you next time.